Hi viewers, welcome back to Health Lab with Dr. Sreeja. Today we are going to start a brand new series, the lab test of the week. In this series, we will be discussing about one lab test every week. The beginning is with the most commonly done blood test, that is the CBC or the CBP test. CBC stands for complete blood count or the complete blood picture. But what do all those numbers actually mean? How do they reflect your health? Let's break it down together. Complete blood count is a blood test that measures several important components of your blood. It's a key tool your doctor uses to check your overall health and detect a variety of disorders like anemia, infections, and sometimes even cancers. It can look like a bunch of confusing numbers if you don't know what to look for. So let's break it down. First, let's discuss the main components of a CBC report. First component is the RBCs, the red blood cells. These red blood cells, they carry the oxygen from the lungs to the rest of the body. If your RBC count is low, you could be anemic. It can make you feel tired or weak. If you have an excess count, it is seen in certain bone marrow conditions and also in dehydration. So if your RBC count is outside the normal range, it is important to dig deeper into the cause. Next is the hemoglobin. Hemoglobin is a protein that is present in the RBCs. It carries oxygen. Low hemoglobin usually points to anemia, while high hemoglobin may indicate lung disease or other conditions. Hematocrit is a proportion of your blood that is made up of red blood cells. A low hematocrit may signal anemia, while high hematocrit is seen in dehydration and other conditions. The proportion of the blood made up of RBC is the hematocrit. Then coming to the RBC indices, we have four main indices, that is MCV, MCH, MCHC and the RDW. The first indicator, the MCV or the mean corpuscular volume, is the average size of the red blood cells. It helps to diagnose different types of anemia. A low MCV usually indicates iron deficiency anemia, while a high MCV usually indicates a vitamin B12 deficiency or a folate deficiency. Coming to MCH or the mean corpuscular hemoglobin, that is the average amount of hemoglobin within the red blood cells. So a low MCH might indicate iron deficiency anemia, whereas a high MCH is seen in B12 or folate deficiency anemia. Then coming to the MCHC, mean corpuscular hemoglobin concentration. That is the concentration of hemoglobin in your red cells. If this is low, it might indicate anemia. RDW is the red cell distribution width. That measures the variation in the size of the red cells. A high RDW is usually seen in iron deficiency anemias, whereas a normal RDW is seen in conditions like thalassemias. Next, we move on to the major component, that is the WBCs or the white blood cells. They are your body's defenders. They fight infections. So there are 5 different types of WBCs: the neutrophils, lymphocytes, monocytes, eosinophils and the basophils. High WBC count might indicate that the body is fighting against an infection or inflammation, while a low WBC count might point to immune system issues. The CBC report also includes something called the differential count, the WBC differential count, which tells us the percentage of the different types of WBCs present in the blood. Each cell, each type of WBC plays a different role in protecting your body. The most common cells are the neutrophils. They constitute to 40 to 70% of the total WBC, and they fight mainly against the bacterial infections. Next comes the lymphocytes, which constitute 20 to 40% of the WBCs, and they fight against viral infections. Lymphocytes are also involved in creating antibodies to protect you from future infections. Coming on to the monocytes, they constitute 2 to 8% of the WBCs. They help remove dead and damaged cells and fight off chronic infections. A high monocyte count might indicate a chronic inflammatory condition. Eosinophils make up 1 to 4% of the WBCs. They are involved in allergic reactions and fighting parasitic infections. Basophils are the least common type of WBCs, and they constitute 0 to 1%. They play a role in inflammatory responses and allergies. A high WBC count can be seen in some chronic inflammatory conditions and certain blood disorders. Finally, let's talk about the platelets. Platelets are the cells that help your blood clot. If you have too few platelets, you might bruise easily or have trouble stopping bleeding. And if you have too many platelets, there is the risk of understanding your results. So, what does all this mean for you? If your results fall within the normal range, that's great. But if they are too high or too low, your doctor will take a closer look to find out what's wrong. Remember, one abnormal result doesn't always mean something serious. It's often just the first clue to a bigger picture. It's important to understand that your CBC can vary for a variety of reasons, like diet, hydration, and even stress. Don't panic if your numbers are slightly off. Your doctor may recommend repeat tests or further investigations before reaching any conclusions. Now you have a better understanding of what those CBC numbers actually mean. If you have any questions, kindly post them in the comments, and also let me know what kind of videos you'd like to watch in the future. Thanks for watching. Until next time, take care of your health and stay curious. Bye.